I'm Maddy Reid. I am in 10th grade, and I am a level 10 gymnast with the dreams of becoming a collegiate athlete.
I am Abby Reid, and I am the head coach and director at Lake Murray Gymnastics, and also the mother to Maddy Reid. I've been coaching for about 26 years.
The day of the injury, I was going onto bars, doing a drill for a difficult release move, and I slipped off backwards because of the lack of chalk on the bar. And I tried to save myself by turning over, and I landed on my arm wrong and heard a pop. I rolled out of the place, and I was holding back tears, and I went over to the trainer, and she thought I had a sprain, but she didn't know to what degree.
The trainer called me while I was at lunch. I was worried about the implications to her training for the summertime and what that would do to her competition season. She is a fourth year level 10, a sophomore in high school. So we are looking at recruitment possibly and how that would affect her future. And so we wanted to make sure we got answers immediately. We got an appointment the next day to make sure that the injury wasn't something further than what we thought, and come find out it was a little bit more than what we originally thought. It was not a sprain. She had a tear.
When Maddie first came in, we obviously, like we do with every patient, we performed a history, we did a physical exam. She was originally seen by Dr. Kyle Arthur, who's a primary care sports medicine specialist in our clinic. Dr. Arthur did an ultrasound. He recognized this injury to the ulnar ligament, and appropriately so, he ordered an MRI. Maddie came to see me afterwards. She had a history and exam that were consistent with an injury to this ligament on the inside of her elbow, and an MRI confirmed that she had basically a complete tear of this ligament. So the ulnar ligament is a ligament on the inside of the elbow that we often refer to as a Tommy John ligament, because it's a ligament very commonly injured in baseball players. But this was an injury that she sustained in gymnastics. We had to make a decision as far as how we go about treating this injury.
We were given several options. One was to not repair it at all. Dr. Mazoué said if she was not a high-level gymnast, it would not have been required. If she wanted to get back to the sport that she loved, she would need the stability of the elbow. And so she opted for the surgery, and the repair went pretty smoothly. He also put a synthetic sheath around the ligament to secure it to the bone so that the recovery time and the recuperation seemed to have been easier because of that path.
The recovery long-term for me went by super fast. At 6 weeks, I started on one arm, doing gymnastics on trampoline and doing the tops, conditioning. And by 12 weeks, I felt brand new, like I could do everything again. And I started working all my skills back, and I felt really ready for competition season.
Over the last few years, there's been some improvements in our technology and our understanding of this injury, where we're actually repairing this ligament more often. What that does is allows for a faster recovery and a faster return back to sport. When you have a very highly motivated athlete, oftentimes they will recover well.
I would recommend Dr. Mazoué to anyone. He has performed a shoulder surgery on my father. He has done surgeries on some of my other athletes, and we recommend him to anyone that we know because we know that they will get the care that they deserve and can trust. But he was also very thorough in describing exactly the process and the options that we had to go over to make a decision that was best for our family. We let Maddie take all of those decisions to heart, and she ultimately was the one that made the decision, but Dr. Mazoué made it very easy for her to see what options there and how they would impact her future.